How long do COVID-associated psychiatric disorders last? Are some age groups more likely to be affected for long periods of time? A prospective cohort study would help address these questions, but previous studies have looked only about 10 months out. Keeping track of a really large cohort beyond that is difficult. So instead, let's turn to a retrospective view of an affected cohort with an unaffected comparison group. Hi, Jim Phelps here for the Psychopharmacology Institute. COVID-19 is known to be associated with many neurologic and psychiatric sequelae, but these important clinical questions remain: duration of increased risk and differences in susceptibility by age, if any. To address these questions, Dr. Maxime Taquet and colleagues looked at de-identified records from, get this, 89 million patients from 8 countries around the world, of whom 1.5 million had documented COVID-19. Think of all the psychiatric and neurologic disorders you've heard are associated with COVID, and imagine what happens to them months, years, 2 years later. Well, here's the good news. Mood and anxiety symptoms revert to their baselines relatively quickly, within 2 months, whereas rates of psychosis and cognitive impairment are still elevated at 2 years. I thought this outcome a little ho-hum until I looked at the details. Take psychosis. The authors are looking at new onset cases, not exacerbations or recurrences. So their results suggest that after COVID-19 infection, the odds of becoming psychotic are elevated relative to the comparison cohort who had a respiratory infection that was not diagnosed as COVID. And this elevated risk continued for 2 years, with no suggestion that the elevated risk is decreasing with time. That's pretty alarming. For all of the illnesses studied, which included neurologic disorders such as Guillain-Barré and epilepsy, the risk of acquiring a new diagnosis is shown as a hazard ratio, greater than, equal to, or less than in the comparison group. And the key aspect of this study, those hazard ratios are shown over time, out to 2 years. That's how we see that the risk of developing psychosis is sustained. The hazard ratio is 1.5 in the first month, meaning a 50% increase in the probability of a new diagnosis relative to the comparison group. But that hazard ratio is still elevated, although lower, at 1.1 after a year, and it's still at 1.1 at 2 years. By contrast, for both mood and anxiety disorders, hazard ratios are increased in the first month after diagnosis to roughly 1.5 and 1.6 respectively, but they rapidly fall to 1.0, no difference from the comparison group, by 2 months. Now let's look at cognitive impairment. What does that look like over time? Well, first let's see how this was measured. All of the other outcomes, getting diagnosed with a mood disorder or an anxiety disorder or psychosis, those were all based simply on a single diagnostic code. But for cognitive impairment, the authors stitched together several ICD-10 codes, trying to capture what's often described as brain fog. Using this composite measure, we see that in the first month, the hazard ratio is 1.6. Brain fog is 60% more likely than in the group that had a non-COVID respiratory infection. The likelihood of a new diagnosis reflecting cognitive impairment decreases to a hazard ratio of only 1.1 by 1 year and slowly declines from there, nearing 1.0, no elevated risk versus the comparison group, at 2 years. For children less than 18 years of age, the picture was quite different. Mood and anxiety diagnoses were not elevated at all. Encephalitis, epilepsy, and several other neurologic disorders showed increased hazard ratios. But psychosis, importantly, again, we see an increased risk of new diagnosis relative to the comparison group, a hazard ratio of 2.0, double the risk. The authors point out that knowing the risk trajectory over time supports clinical guidance. For example, if no anxiety disorder has been diagnosed within 2 months of COVID, then the risk thereof is not likely to be greater than after a non-COVID respiratory infection. By contrast, vigilance for psychosis should remain increased for at least 2 years. For more on all this, Figure 1 in the article presents hazard ratios over time for all of the diagnoses considered. The patterns are interesting.